Hi again, guys. We're just going to go through muscles of the face. As you know, it's Dr. Sisnet. I'm just going to try to be as concise as possible, okay? So the first muscle we're going to talk about is the occipital frontalis, which is up here. It is a digastric muscle. It has two bellies, which is occipital and frontal bellies. They share a common tendon, which is the epicranial aponeurosis right here. This aponeurosis facilitates independent movements of or contractions of the muscles. But in essence, when the muscles work synergistically, they allow you to raise the eyebrows. So the frontal belly is actually involved in protraction, which is the frontalis, and the posterior belly is involved in retraction, in contraction, sorry. So, like I said, both when they act together, they are involved in raising the eyebrows, okay? So the origin and insertion of the muscles you have to know for the frontalis as well as the occipitalis. We're just going to talk about the insertion of the frontalis, which is the skin and subcutaneous tissue of the eyes and forehead, while the origin of the frontalis is actually the epicranial aponeurosis, which is, I think this is supposed to be the representation up here, but there are other diagrams that are a little bit better. So let me just try to turn into the next image and see if that would be a little bit better. So you can actually see the epicranius here, but it's supposed to be a representation of a tendon between the occipitalis right here and the frontalis right here. But you should get the idea what I'm saying, right? So the origin and insertion of the occipitalis now is occipital belly of the occipital frontalis is actually the lateral 2/3 of the nuchal line, or 2/3 of the superior nuchal line, and its insertion is into the same epicranial aponeurosis. That's why they're able to work synergistically. Just an aside, the nuchal lines are located posteriorly, and there are 4 of them. They're like grooves or ridges, in the posterior skull. There's 4. There's the highest, the superior, and the median, and the inferior. Some books actually put that the highest is actually the insertion of the origin of the occipitalis, but my book actually puts that the origin is the superior nuchal line. Okay, so let's keep that in mind. I would hate to think that an exam would actually test you and ask you if the highest or the superior, because I've actually was trying to find out which one is the correct, but most books have the superior, lateral 2/3 of the superior nuchal line. Okay, next muscle we're going to look at is the Orbicularis Oculi, and it's located right here. Let me change the color so you can get a better idea. That's it right there. And the Orbicularis Oculi is a muscle that we usually examine when we are doing cranial nerve 7 examination. Most persons are aware of it. The muscle is circular, and it has an origin in the medial orbital margin. Medial orbital margin here. Medial palpebral ligament right here. And the lacrimal bone, which will be underneath here. And it has an insertion into the skin around the margin of the orbit. So, well, the skin has been removed for this dissection, but it's the skin around the margin of the orbit and the superior and inferior tarsal plates, which is basically the upper and lower eyelids. Okay, and it's involved in closing the eyelids. How we test that? We actually test it via asking the patient to close their eyes as tightly as possible, and we try to open their eyes against resistance. Okay. The medial, just on the side as well, just to make sure that we understand all of the anatomy, the medial palpebral ligament is attached anterior to the frontal process of the maxilla. So underneath here, you would have the maxillary bone as well as the lacrimal bone here. And it is in front of the lacrimal bone and posteriorly to it as well too. Sorry, it's in front of the lacrimal bone and posterior. So right here, as I mentioned before, is the tarsus superioris, or the tarsal plate, and right here is the tarsus inferioris. This is the medial palpebral ligament, as I mentioned before, and this is the well, you can't really see the tendon of the levator, but it should be there. Okay. Next muscle we're going to look at, you can't really see it in this muscle, is the Corrugator Super Cdi. So I'm actually going to change the image and let you see it a little bit better. I'm going to zoom in, and here we have the Corrugator Super Cdi right here. As you can see, it moves in a superlateral direction. It has an origin into the medial end of the superciliary arch, and it has an insertion into the superciliary arch, which is just on the side, is a bony ridge above the eye socket. Okay, it's not the eye socket, but a bony ridge above it. And it also has an insertion into the skin superior to the middle of the supraorbital margin. So you can see, the skin has been removed from the dissection or the drawing itself to show the muscles themselves. So the Corrugator Super Cdi, as I mentioned, it passes superolaterally between the palpable and orbital portions of the Orbicularis Oculi, as you can see right here. Next muscle we're going to look at is the processus and the transverse part of the alias. I'm just going to show you where it is, and I'm going to show you all the muscles in the order that you can try to remember them if they bring a diagram and ask you to label. But most times in the diploma head and neck surgery and most Royal College examinations, have never heard of them asking you to label a diagram per se. So this is the procerus, the next muscle is the nasalis. This is the levator labii superioris, alacae nasi, LL, levator labii superioris, alacae nasi. So LL san, it's a very long name for such a small muscle. I always wonder why it was named so long, but between the procerus and the nasalis and the levator labii superioris, they actually form a kind of a triangle, if you can see right here. It's not really clinically significant, but it's just interesting that they form a triangle, so you know that the next muscle that you encounter after the nasalis is the levator labii superioris, alacae nasi. Underneath that, you have the levator labii superioris, and the next muscle you're going to come into contact with is the zygomatic minor. I don't think you can see it. Sorry, let me just bring out the diagram here. Can you see it here? You can see the zygomaticus, but I don't see them. They haven't actually put like the zygomatic minor and zygomatic major. On this diagram, they have the zygomatic major and minor. On this diagram, you can actually see this is the zygomatic minor here, and the zygomatic major right here. Zygomatic minor has an origin from the anterior aspect of the zygomatic arch, while the zygomatic major has an origin from the lateral aspect of the zygomatic arch. That's how you can just basically track it and find out which one is the major and the minor. Okay, so let's zoom out again. Lying right here, so you have the zygomatic minor, zygomatic major, and then right here at the bottom here, let me just get the paint again, is the levator anguli oris. Sorry, the muscle has been missed. The levator labii superioris is right here. It's not labeled on this diagram. Oh, it's labeled right. I knew it. Sorry about that. Had a little bit of a lapse there. So just after that, you see the levator labii superioris. Then you come to the zygomatic minor. Then the zygomatic major. So remember procerus. Then the next part of the triangle will be the nasalis. Then the next part of the triangle coming down to the levator labii superioris. So the levator labii superioris, alacae nasi. Then you come to the levator labii superioris. Then the zygomatic minor, zygomatic major. Then a muscle that actually inserts into the angle of the mouth, which should be the levator anguli oris, right here. Okay. Interesting to note, on the side, that all of the muscles of facial expression of the face are innervated by cranial nerve 7, developed from the second branchial arch. Remember that the first is innervated by 5, the second innervated by 7, the third innervated by 9, the fourth by 10A, and the sixth is by 10B. So just remember that. Masseter should not really be included because the masseter is innervated by the mandibular division of the trigeminal nerve. As you know, all of the muscles of mastication are innervated by that nerve. So the origin and insertion of the levator labii superioris, alacae nasi, is actually inferior medium. As you can see, it has an origin from the inferior aspect of the orbit. So let me just get the diagram here again, the paint. So you can see that this is the muscle here that we're talking about, and it has an origin in the inferior aspect of the orbit, and it actually inserts into the major alar cartilage. Okay, and its purpose is actually to make the nostrils bigger, or to involved in flaring the nose, and it actually works with the alar part of the nasalis to flare the nose. So when you're running and you flare your nose, that's the levator labii superioris, alacae nasi. All right. So the next muscle that we're going to talk about is the levator labii superioris, which is right here. So remember I told you it goes from levator labii superioris, alacae nasi into the next muscle, which is the levator labii superioris. Then it goes to zygomatic minor, zygomatic major, and then you can go down here, which is the angle, which lies the levator anguli oris lies between the zygomatic minor and the zygomatic major, and then you come further down, you come to the buccinator, and finally to the rhizorius. Okay, so the origin of the levator labii superioris is the infraorbital margin, and it inserts into the skin of the upper lip. Let me just remove all the drawings that I put here, making it look like graffiti. So the origin is actually from the infraorbital margin and inserts into the skin of the upper lip. And the zygomatic minor, the origin is from the anterior aspect zygomatic arch, as I mentioned before. Both of these, the zygomatic minor and the levator labii superioris, both of these muscles are actually involved in inversion of the upper lip. Because think about it, they both actually insert into the upper lip, so they're involved in eversion of the upper lip. And they deepen the nasolabial sulcus, so they're involved in sadness. So how I like to remind it is that sadness is actually supposed to be supposed to take up a minor part of your life. So you're supposed to be happy most of your life. So the zygomatic major is actually involved in you smiling. So it's a major part of your life. So it's involved in you being happy. So it is when you're smiling or basically being happy, the zygomatic major comes into action. So we're going to talk about the origin and insertion of the zygomatic major, which is the lateral aspect of the zygomatic bone, and it also inserts into the angle of the mouth as well as the zygomatic minor, but it elevates the commissure. Remember, the commissure is actually the angles or the corners of the mouth, and it is involved in smiling, along with the levator anguli oris, not the levator labii superioris, the levator anguli oris, along with the zygomatic major, is involved with smiling. So to group the muscles, the levator labii superioris and the zygomatic minor is involved in frowning, and the levator anguli oris and the zygomatic major is involved in smiling. Okay, next muscle we're going to talk about is the buccinator. As you can see down here, the arrow is pointing. Arrow is pointing right here, and its origin is the mandible, as well as the alveolar processes of the mandible and maxilla, and it inserts into the Orbicularis Oculi, and as well as the angle of the mouth. So not the Orbicularis Oculi, Orbicularis Oris, must remember not to mix up these two, apologies for that. It inserts into the Orbicularis Oris, and it is in keeping food on the occlusal surfaces of the teeth along with the tongue, so it presses the cheek against the molar teeth. So when you're chewing, the tension that you get from the buccinator is involved in actually maintaining that food onto the occlusal plane along with the tongue, so that the food doesn't get trapped in the vestibule of the mouth. So it's a very important mouth. Important part of our muscle are used in the mouth. How do you test the buccinator for a cranial nerve 7? You ask a person to blow out their cheeks, and then it's kind of a way to test not only the buccinator but as well as the orbicularis oris, when you ask the person to close their mouth tightly and blow out their cheeks. But technically, when you press each person's cheeks and they have it blown out, you're actually more so testing the orbicularis oris, but you're also supposed to be testing the buccinator as well too. All right. Finally, we come into the Depressor anguli oris, which is right here.